Extrovert thinking, that's about utilizing, seeing externally how you can take what can logically be done and make it effective for people around you and your workflow and everything. So how much does your field require you to keep an effective workflow with others around you and ensure things are running smoothly and efficiently?
I would say that's 100% of what I do every single day. Both in the, and you've seen it. I mean, in the operating room, I again, I'm kind of the ringmaster. So I'm, and there's half a dozen people in there, sometimes more, that are all trying to, for the most part, help me and my patient, have an optimal outcome. And so harmonizing that and efficiently getting things done, safely getting things done, and also kind of making sure everybody's doing what they need to do, is absolutely part of what I do. And that actually happens in the office too. I mean, this morning I saw 25 patients, and I had a medical assistant helping me, my secretary, the x-ray tech. And so everybody's got to kind of work efficiently to get people seen and take care of, and, diagnosed correctly, correct treatment, correct follow-up. And so that kind of extroverted organization of things is very, very important.
Awesome. That's good. That tends to be the case with most surgeons, it seems like, because you're in charge of the whole team. You got the PAs and the nurse and anesthetist and the team working with you. Like, you got a whole team in there. And like you said, it's important to, you're the ringleader, and it's important to, keep an eye out for everybody, making sure everyone's doing their job effectively, so that everyone can get the results that, you're aiming for.
Correct.
Yeah. Another side of the thinking spectrum, so that was extrovert thinking. Introvert thinking is about paying attention to what you logically understand, reasoning, understanding not just what you could do to ensure effectiveness, but also what you could do, or why is it effective? Like, understanding why these outcomes are the way they are. How'd you get there? So how much of your time is spent trying to, understand the diagnosis of your patient versus treating it? Because, when they compare surgeons and, medical doctors, it's a stereotypical, like the easy, simplistic way is basically the doctors do the one that figuring things out. But surgeons are more, action oriented. They treat the problem. Not that doctors don't treat, but like more time is dedicated to diagnosing and figuring things out versus actually treating. So how much of your field requires you to actually spend time figuring stuff out about diagnoses and understanding the process of how the patient got there?
Yeah, I think part of what you said is true, and that is in my field, in my particular field. I think orthopedics in general, and especially with sports injuries and arthritis, and especially at this point when I've been doing it for decades, I do very, very quickly, most of the time, know what's going on. If I see somebody in the office who had a knee injury, I can usually tell within a minute of pretty much what exactly the problem is. And then I will spend some time making sure I'm correct, and coming up with a treatment plan. But again, with something so specific, like someone comes to see me for a knee injury or a shoulder injury, it's not a cascade of medical events. It's not a cascade of even symptoms like might come along with flu or something medical. So a lot of what I do is fairly easy to diagnose if you've been doing it for a long time. And then a lot of times, once I know what the diagnosis is, even the treatment plan is pretty simple. There's only a few options, and I go over that with the patient, make my recommendation, and typically proceed. So to some extent, what you said is correct. A lot of surgical, decision making and making of diagnosis is pretty quick. It can be. And then the treatment plan also can be fairly quick, and, to treat the patient for that problem.
Okay. That's good to hear. Yeah. Okay. And then, so for the last portion, so those were the thinking functions. So now going over to feeling functions. These are about harmonizing and valuing. So starting with harmonizing. This is basically extrovert feeling. It's a harmonizing function. So it involves being aware of how other people are feeling, what their values are, connecting with others. So how much does your field require you to be harmonizing and connect with others?
Probably more so than I ever realized.
Yeah.
And I think that's a common, possibly a common misunderstanding about surgeons and surgery, is that it can come across as kind of a bit of a cold specialty, like like you don't care, like this is broken, I fix it, thank you, goodbye, and that's kind of it. But I've learned over the years, and I also think that I did go into this obviously because I really enjoy not only fixing things, but I do enjoy taking care of people and making them better. It's a big part of it. So I have learned, definitely to use your term, to harmonize with my patients and to empathize. I understand that they're in pain, and I want to help them. And it's very satisfying to be able to do that for people. And so I think that aspect of what I do has actually grown and helped me enjoy what I do even more.
That's awesome. Yeah. And finally, introvert feeling. This is now about being attuned to your own values, ensuring that you're personally happy with things that are going on, being authentic and true to what your core values are. So how much of your field requires or allows you to do what you're authentically passionate about? And also, how much of it does it require you to leave time outside of work to do what you're passionate about? We kind of touched upon this earlier, but
yeah, but that's again a very good question. I think that those aspects of it are absolutely there, and I think that again over the years they've become more apparent to me. In the beginning it was getting my practice set up, getting busy, getting volume, see more patients, do more surgery, that kind of stuff. And I always enjoyed it, and I enjoyed taking care of people. I think more as I got more into this over the decades, I've given myself more time to be with my family because of my schedule. So I don't take call anymore. And so I think if you're fortunate enough to have a busy practice that's elective and you can schedule these things, you can have a very good work-life balance, and you can have this ability to harmonize not only with your patients, but to have time to have, family and weekends and things like that. That absolutely exists. Yes.